San Juan 11A from the Group 18. Okay, now let's proceed to the assessment of the cardiovascular system. So prior to perform the procedure, review the client's medical record. And after that, determine the scope of the assessment if it is needed. Prepare the needed equipment such as the pen light, the ruler, and also perform the hand hygiene. And also don't forget your stethoscope. Okay, ma'am, good day. I am your student nurse, Brianna Sacanaliazo. Can you please tell me what is your name first?
I am Yulian.
Okay, ma'am. So, when is your birthday?
August 23.
And then your age?
I am now 19 years old.
So, what would you like me to call you, ma'am?
Just call me Jean.
Okay, Jean. So, I'll be assessing your cardiovascular system, which means I'll have to check for your pulse on your neck, and also in your arms, and also in your legs. And of course, listen for your heart sounds. Will that be alright, ma'am?
Yeah.
Have anything else? I'm just going to close the door
Okay.
for your privacy. So before we start, do you have any existing or any history of your cardiovascular problems as well as your lifestyle habits that are risk factors of the cardiac problems?
Okay, so far I don't have any.
Okay, ma'am. So can you do these supine positions? Just lay down, and I'm just going to put this pillow on your head. So just wait me, ma'am. Okay, ma'am. Can you please? Okay, are you comfortable with your position?
Yes.
Okay, so ma'am, can you please turn your head slightly to the left? So I'm just going to shine a light. Okay. 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 If the jugular tension was noted, assess the jugular venous pressure. So by looking the highest visible point of the distension of the internal jugular vein, as deemed necessary, raise or lower the hand of the bed by the 30, 45, or 60, and also the 90 degrees. So until the highest visible point of the detention of the internal jugular vein was observed. So first, so ma'am, let's check your jugular vein. Okay, ma'am. So, can you please turn to the other side? Okay, ma'am. So, it's good. So, okay, ma'am, can you please turn your head on this side? Left side po. So, I'm going to palpate your carotid arteries. Okay, so, okay, ma'am. So, please turn to the other side. Okay, so now I'm just going to get my stethoscope to listen for your breath. So now I'm just going to place the bell of the stethoscope for your carotid artery. So, okay, ma'am, let's start. Can you do the inhale and hold your breath for a second, ma'am? Okay, next, the other side, ma'am. Okay, so now, let's proceed on the inspection and palpation. So, now I'm just going to do the general inspection on the chest wall and look for any abnormal pulsation. So now, ma'am, I'm going to proceed inspecting your chest area. So now, to the inspection of the heart or the pericardium, first thing to do is to begin with a general inspection of the chest wall. And now I'm looking for any pulsation symmetric for the movement and traction of the hip. Okay, ma'am. So let's start. Okay. 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 So the hips are strong outward thrust for the chest, which I don't see. So now, simultaneously inspect the pericardium for the pulsation while palpating for the aortic, pulmonic, and tricuspid and ethnical area. First, palpate for the hips or lift using the palms or the finger pads flatly or obliquely against the chest. So first, okay, ma'am, is it okay to? Okay, okay, ma'am. Okay, so okay. Now, let's press the ball of the hand firmly against the chest wall and feel the thrills. Okay. 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 So let's proceed in palpating the apical impulse using the palmar surface of two, three middle fingers. Okay. 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 So, and for the finer assessments, use of one finger only to confirm the characteristic of the impulse. So, okay, okay, okay. So, if unable to palpate the apical impulse with the patient's supine, position the patient to roll partly onto the left lateral side. Okay, ma'am, can you please? So now, inspect and palpate the epigastric area. Okay, ma'am. So let's do this again. Okay. So now the next thing to do is to assess the heart rate and rhythm for the patient by placing diaphragm of the stat on the patient apical area. So first, okay, ma'am, is it okay to open it again? Okay, so using the diaphragm of the step first, then the bell, listen for the patient heart sound on his four anatomic site. First, I'm going to listen for the aortic area. So, okay, so third that, the pulmonic area. Okay, let's proceed to the tricuspid area. Okay, and then repeat this step with patient facing his left lateral side and while the patient is sitting. Okay, ma'am, can you do the sit down and slightly lean forward? Okay, ma'am. Now, you're just going to do the inhale and exhale. Okay, ma'am, let's start. Can you please do the inhale, exhale, and then hold? Okay, ma'am, can you repeat it again? Inhale, exhale, and hold. Okay, do it again. Inhale, exhale, and hold. Okay. So, ma'am, now I'm going to inspect your arms and legs. Okay?
Go.
Okay, I'm just going to get a pillow, ma'am. Okay, so ma'am, I'm going to inspect your arms and legs. Okay, can I see your hand, please? Okay, next. Okay, the temperature is warm and the skin color is consistent. And then no venous patterns, and I'm looking for any venous patterns, lesions or edema which I don't see. So now I'm going to assess your capillary refill. Okay. Okay, ma'am, can you please give me your hand? The other side. Okay, ma'am. So now I'm going to assess your radial pulse. Okay, and then next. Okay, now is your ulnar pulse. Okay, ma'am. Okay, next. Now is your brachial pulse. Okay, ma'am. And then next side. Okay. Okay, it is good. Your pulse are bilaterally strong and graded 2 pulse, which means normal. Now I'm going to perform the Allen test. Okay, ma'am. Now I need you to open and close your hands as quickly as you can. Okay. 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 So after that, you need to first, I'm going to listen for the aortic area, ma'am. Can you please roll? Okay, let's start, ma'am. So, I'm just going to listen for your aortic area. Okay, and then the pulmonic area. Okay, then the tricuspid area. Okay. For the apical area. Okay. Repeat these steps with the patient facing his left lateral side while the patient is sitting. Now, ma'am, I'm just going to palpate for your pulse. So now I'm going to start for your popliteal pulse. Can you please raise your knee for me, ma'am? Okay. And then the other side. Okay. So, moving on to your dorsal flex with the pulse. Okay, so both are equally strong and has regular rhythm. Now for your posterior tibial. Okay. I-check lang na ko. Wala ko buhaton.
Wala.
Okay, moving on to your dorsiflex by the pulse. Okay. Okay, and after that, your tibial. Okay, both are equally strong and has regular rhythm. And now for your capillary refill. Okay, we're done with the cardiovascular assessment and just going to sum up everything that we've covered. So upon auscultation for your neck, I've heard no swishing or blowing sound pulse. Also, equally strong rated 2 pulse, which means normal. Upon assessment of your chest wall, of your heart, chest movement is symmetrical with no retraction or any heaves, and the heart rate is 75 beats per minute. From your upper and lower extremities, assessment arms are bilaterally symmetric, and your radial pulse and ulnar and also your brachial pulse are bilaterally strong and has regular rhythm. And then the Allen test result is good, and upon examining your legs, hair is eventually distributed and no skin lesions, and the overall, your cardiovascular is functionally well. And do you have, Mom, any questions or regarding the assessment?
None so far.
Okay, Mom. So thank you for your cooperation, and that's it for your cardiovascular system. Okay? And that's all for the cardiovascular system.